To those in business, especially health insurance or health management organizations, or what they call HMOs, managing the administration side of business is always a challenge. Now, technology is helping to fill in the gaps where they exist here. Today, we break down an application which has been developed for the purpose of dealing with that problem.
In this digital era, the world has seen a lot of transformation in technology. In Uganda, to be precise, healthcare technology trends continue to drive growth in the medical industry. Among the trends, nothing is hotter than the digitalization of healthcare. ClinicMaster software has helped improving healthcare services, as Frank Montevi explains.
ClinicMaster is a health information management and medical billing system that automates patients' transactions in a hospital or clinic based on visits and daily procedures.
Here are just a few ways of how this health tech works.
It all starts at reception, where the patient's details are entered in the system and a visit is created right there. So the different points in a hospital are alerted. And as all this data is entered, it's stored onto the central database. So the patient proceeds to the doctor. The doctor will enter all the clinical notes, the laboratory requests, the drugs, and all that information is stored onto the central database. Once the patient gets discharged, information is synchronized on the central database, and if a patient goes to another facility anywhere around the country, they can access the same information while there. The doctor can access the treatment.
These are the significances of using this software.
This reduces on the cost of treatment because the doctor doesn't have to do the same tests again if they are not necessary. And it also saves on use of paper because the patient doesn't have to move with a book from one hospital to another to show the doctor what was done at a previous facility.
Life being precious needs saving, and this influenced the generation of this kind of technology.
The idea was derived from a real-life situation where we had a baby who had to come for their refill and they were not able to come to pick their medication because they missed the appointment, and at the end of it all, that baby died. And it was just because there was no system to track whose appointment is due for refill.
Deploying the software in health facilities has registered an increase in customer base.
We've been able to increase our customer base from no client to over 120 clients in the region. Hospitals that have benefited from our system, one of them is Mengo Hospital, Lubaga Hospital, Novik Hospital, Paragon Hospital.
However, there are hurdles you can hardly neglect.
Some of the challenges from the clients probably is power. People are not able to get power to run the systems because we know very well that some places are in remote areas that do not have power. Changing the mindset of clinical people who are used to writing on paper to now use the system is another hurdle we've found in this fraternity. The other challenge is connectivity, because you cannot have internet or connectivity up and running 24/7.
Frank explains the steps taken to overcome.
We have managed to handle some of these challenges by reducing the cost of investment on the client side in a way that we have created a central data center where different hospitals can push and pull data. That has solved the problem of huge investments on the acquisition of the system.